An economic assessment by Standard & Poor's Global Ratings threw more cold water on the bill. If enacted, it would result in 580,000 lost jobs and $240 billion in lost economic activity by 2027, keeping GDP growth stuck in low gear of around 2% at best. In hopes of finding more backing, Republican senators leading the effort released a changed version of their bill that included a table showing some states where senators have been undecided, such as Alaska and Maine, would get more money. For 7 years, Republicans have hammered Obamacare, which extended health insurance to some 20 million Americans, as an unwarranted and costly government intrusion into healthcare, while also opposing taxes it imposed on the wealthy. President Donald Trump made repealing Obamacare one of his top campaign promises in 2016. Democrats have fiercely defended it. A total of 3 Republican defections would kill off the latest anti-Obamacare effort. Republican Senators John McCain, Rand Paul, and Ted Cruz have said in recent days they would vote no. Other senators such as Susan Collins and Lisa Murkowski have also voiced reservations. A spokesman for Paul said on Monday the senator still opposes the latest version despite the tweaks. A Cruz aide said the Texas conservative is not currently a yes on this bill, but we continue to work toward lowering premiums. Slim margin. Trump said there was little room for Republican wavering on health care. We have 52 senators, so you lose 2, you're out, he told the Alabama-based Rick and Bubba radio program on Monday. We don't have much a margin. We don't have any margin. Democratic leaders roundly rejected the revised draft of the repeal legislation as a sleight of hand to gain support. I've been thinking a lot over the past few days about what we would do in Pennsylvania if this bill passes and becomes law, she said. And honestly, I struggle to figure out how we would respond. We would have 2 years to completely revamp our healthcare system. The last attempt to repeal Obamacare fell 1 vote short in July, in a humiliating setback for Trump and Senate Majority Leader Mitch McConnell. The new bill, originally introduced by Senators Lindsey Graham and Bill Cassidy, would take federal money spent on the Medicaid program for the poor and disabled, as well as subsidies to help Americans buy private insurance, and divvy it up to the states in block grants. Advocates say that would give states more discretion to manage their own health care schemes. Opponents fear undoing Obamacare will mean millions lose health care, including some with pre-existing medical conditions. The 2 largest health insurer lobbying groups on Monday renewed their criticism of the bill, sending testimony to the Senate that it would destabilize the individual health insurance market and hurt consumers. U.S. hospital stocks were down across the board on Monday morning, in broadly bearish trading market-wide. Shares of HCA Healthcare Inc. and Tenet Healthcare Corp. were hit particularly hard, falling 2.8% and 5%, respectively, in afternoon trading. Paul wants significant reassessment. Paul, from Kentucky, said the Graham-Cassidy plan was still too similar to Obamacare. My promise to the voters was to repeal Obamacare, not block grants and keep Obamacare, Paul said in a statement. Only a significant reassessment of the trillion-dollar spending regime would get his support, he said. Collins, a moderate from Maine, said on Sunday it was difficult to envision a scenario where I would end up voting for this bill. She worried about cuts to Medicaid benefits to the poor and disabled. Graham suggested Republicans could have another shot at repealing Obamacare, even if they do not do it this week, if Senate leadership were to attach a repeal bill to a planned tax reform package. That package was expected to be designated in 2018 for the once-per-year procedural advantage of being handled under the Senate's 50-vote reconciliation process. Trying to combine the two would be highly unusual. The nonpartisan Congressional Budget Office is expected to produce as early as Monday a preliminary analysis of the bill that would assess its impact on budget deficits. More time is likely needed for the CBO to gauge how the bill could affect Americans' access to health insurance.